Do you have red, itchy, burning, or sandy eyes? Then stick around because this video might be for you. Hi, I'm Dr. Michelle Lee, and I'm a board-certified ophthalmologist and cornea specialist, and today I'm going to talk all about dry eye. When we talk about dry eye, we mean an eye with dry spots on the cornea, or the front layer of the eye. Today I will do my level best to tell you what I think you need to know about this extremely common and often debilitating eye condition. The problem with the term dry eye is that there are many different types and causes. In my mind, there are two kinds of dry eye. There is the kind of dry eye where you don't make tears, and the kind of dry eye where you make tears. If you cannot make tears, for example, you go to a movie and you feel very emotional but you can't create tears, you may have aqueous deficiency, which could be a sign of something more serious. If this is the case, I would recommend seeing your eye doctor in order to rule out something systemic or an ocular surface condition that may be affecting your tear production. The majority of people with dry eye make tears. In fact, sometimes people come in because their eyes feel more wet than dry. It's just that the tears you're making are poor quality tears that aren't doing a good job lubricating your eye. There are so many different causes for this type of dry eye. But if this is you, my first tip is to start an artificial tear, preferably a preservative-free artificial tear. Bottled tears have a preservative called BAK, which if used excessively can actually cause ocular surface toxicity and inflammation and can really worsen dry eye in the long run. Meanwhile, preservative-free tears are free of BAK or any other type of preservative and come in little individual vials that you can actually use throughout the day and discard within 24 hours. These are hands down worth buying, especially if you are using these tears on a daily basis. I'll link some of my favorites down below. The next thing you need to know is that not all dry eye treatment works for everyone, and there are so many different reasons that you might have dry eye. Sometimes dry eye can be a result of a medication you're taking, or your eyelid position, or even a systemic condition that you have. There's also a chance that that redness and eye pain that you're having is not dry eye and should be addressed immediately by your eye care provider. And if your symptoms are not controlled with preservative-free artificial tears, it is important that you see your eye care provider so that we can make sure everything's okay and escalate treatment as needed. So I hope this information was helpful. Please consider subscribing to my channel. I release a new video every Saturday. Please give this video a big thumbs up, and I'll see you next time. Bye!